Hello, everybody. Welcome back to Medical Monday.
Hey, everybody. Welcome back.
We're going to be going over radiculopathy. Okay, this is a very common patient complaint that we get in the clinic here because we also specialize in back problems, and that's where a lot of this radicular symptoms come from. Those sharp shooting pains can either be down the patient's leg or their arms.
Yep, absolutely. And actually, a common diagnosis of radiculopathy is in our name, and that would be sciatica.
People refer to radicular symptoms as sciatic pain.
Yep, you are correct.
And it's that shooting pain that we feel down our legs. And we see about 3 to 5% of all adults get radicular symptoms throughout their life. And it's not specific. It's not, most conditions, more often males will have it or more often females will have it. And this is non-discriminatory. Both of us have got about a 3 to 5% chance of getting radicular symptoms.
Have you ever had them?
I have before.
Yes, so have I, in both my arms and my legs.
Okay.
Yeah.
Not anymore, though.
Not anymore.
Not anymore,
no,
which is a good thing.
Yes.
It's very treatable.
And one of the things that I want to share is on dictionary.com, I like definitions of things. It helps to open up and give clarity sometimes on what things mean. And so radiculopathy actually means disease of the spinal nerve roots. Disease of the spinal nerve roots. And so that is where radicular or radiculopathy symptoms come from, are the nerve roots themselves.
Yeah.
So it's a very
nerve roots come from the spine, and that is where oftentimes it comes from. That's why it's called from the nerve root problem.
Exactly. And nerve roots actually give us different signals. There's 2 different types of signals that we can assess for here in the office. One of them being myotomes, myo meaning muscle, myotomes. And then the other meaning dermatomes, and dermo meaning like dermal, like skin, and sensation is what we're checking there. So you can have different types of radiculopathy in regards to location, and then also type of. You can have muscular radiculopathy or even sensory radiculopathy.
And that helps us determine when a patient has a complaint of it comes down the top of my shoulder or the back of my shoulder or the front of my leg or the back of my leg. That helps us determine exactly where this nerve root dysfunction is starting from, where these radicular symptoms are originating.
Yep, it does. Actually, you can trace it back to the nervous system or down what's happening. And I really love this this visual, which is why I used it. You can see the different labels, S1, L5. What that stands for is sacral nerve or lumbar nerve. Those happen to be in the low back, which is why you see the legs here. But you see how the different tracks that has affects different areas. And what that does for us is allows us to better understand what level of the spine is affected, and then how much is affected, where it's affected, things like that. So it's almost like an investigator, right? What's the big famous one? I can't think of it.
Sherlock Holmes.
Sherlock Holmes, thank you. So we're like the Sherlock Holmes of nerves.
And that's what medicine is. We get a patient, they talk about their complaints, their symptoms. We call it signs and symptoms. That helps us paint a picture to where we know exactly where the problems are, and help us determine the fix for that problem. So as we know, these radicular symptoms, they come down, originate from the nerve root itself. We've determined where they actually are because of it's on the outside of the arm or the outside of the leg. We can determine within the spine where the problem is, but what's actually going on in the spine?
Yes, absolutely. So the spine itself are a whole bunch of individual bones that stack on top of each other, just like you see right here by me. And what these bones do is they stack very strategically so we can get different types of movement, whether it be bending backwards, so we can bend backwards like this. We can bend forwards and kind of stretch it open, and then also side to side. Can we move sideways or the other direction? All right.
And when we look at this model, she has those bony pieces on the back. You can actually feel those if you touched your back. So that would be actually at your back right there. And this would be your belly.
Your belly. Yeah. And so that's what we're looking at here. Your belly, your back. And so with that, there's a lot of different components that allow this movement to happen. When we talk about radiculopathy and where it's coming from, it almost always comes from where the nerve root comes out itself. These little holes you see, that hole is for a nerve to come out of.
Those are big, nice holes on this one. So that's kind of a misnomer.
Yes.
Because those would be happy nerves coming out of those big holes.
That would be happy nerves. And so what happens is we'll get damage to the disc space. This is an image of a disc. And that disc will go right flat on top of there, and then another vertebra would go on top of it. So you can see that pattern here, bone, disc, bone. In the back, you see that there's facet joints. We haven't used that term yet, facet joints. And what they do, I describe that as they stack like shingles. They kind of sit on top of each other like this, and there's a joint capsule that wraps around them.
Well, you can see it right there.
That's exactly what this is a facet joint where one is sitting on top of the other. There's a little bit of cartilage between the two. And then you can see the joint capsule here wrapping around on either side. And there's actual fluid in that joint space to allow us to have ease of movement. But what happens when we talk about radiculopathy is there's damage or irritation in that joint space.
Yeah. So that joint space she talks about, you see the cartilage very smooth, makes it easy to move, and that capsule keeps that special fluid in. It's not a blood product that keeps that capsule healthy, it's a special fluid. And that fluid with people who do not move or have injury can become very thick and very painful. So a big part of the movement with that is to keep that space healthy and happy. And the scientific report from Daniel Badavy noted that the exercise is a positive effect on the intervertebral disc metabolism. So not just the disc itself, but the joint space has got to be moved so that that fluid can be nice and thin and help lubricate so that they move comfortable.
Yep, and he said the word move quite a bit. Exercise requires movement. Movement is what allows joints and muscles to stay lubricated. It's a phenomenal pumping process that our body does, and we don't even think about it. We just do it.
We always say motion is lotion with joints. You need to move them.
Lotion. Yes, we do. And this is another great visual that I liked. You can see here where everything is stacked, and this actually has the nerve root coming out of the spine that you can see. Above here is a facet joint, and you can see a healthy facet joint here. This is an irritated facet joint, and then here's an irritated one there. So you can see the difference when we have that lack of movement or that lack of fluid that needs to exist.
And that's oftentimes referred to as degenerative changes. You'll hear multiple, sometimes we confuse patients with multiple terms for the same thing, whether it's arthritis, degeneration, degenerative disc disease, they all really refer to the same thing as far as that joint space not being healthy, and now it's changing.
Yes. And what happens when we have this irritation is we get those dermatomal or myotomal responses where we say, it's only these 3 fingers that I feel the pain or that I feel the irritation, or I can't feel it here. What's going on? And so that when there's irritation on those nerve roots, this is what's going on, and we can trace it backwards.
Yeah,
absolutely. And you talked about degenerative change, right? So we've been focusing more on the facet joints. They're a very small joint on the back of the spine, but there are a whole bunch of them. Each vertebra has 2 or 4, 2 above and 2 below. And so with that shared, there's other forms of degeneration or arthritic changes that happen.
Yeah.
And typically they come together. If you have one, you'll have some form of the other, or if you have the other, you have some form of the one. So with that,
kind of like peanut butter and jelly.
Just like peanut butter.
You don't have just one.
No, you don't. Because if you don't, it's a little dry.
Nobody eats peanut butter sandwiches.
No. So what you can see here is a healthy disc and a healthy facet joint back here. And then again, as we go down, you see how there's some spurring that's forming. That's just damage or growth to the bone because it has stress in that area. You can see this disc looks a little different, and even that nerve root's a little irritated. And then we have a degenerative disc and then further degeneration. And you can see how the back portion also changes with that. So there are different types of degenerative change or arthritic changes that can occur to affect the nerve roots in different ways in different areas.
I like how this picture really emphasizes at the very top you got a healthy space, and then as you progress down it's mild, moderate, and then severe degeneration. So you can see all the stages in one picture.
Yep,
that's good.
I do enjoy this.
But if you're having radicular symptoms, if you're having sharp shooting pain down your leg or into your arm, there's a lot of things that you can do at home. And what we always want to tell patients is, what are the things that you can do at home to help get better? Yes. And what's the first one you think of?
Yes, rest. I always like to just rest. Let's take a break. It's irritated. I can't really function very well. I'm not able to do a good job, so I'm going to go rest. We've talked quite a bit of the acronym RICE. R-I-C-E. Well, I've modified that so that it's RISE for this. It's very hard to compress and elevate our spine. And so with that shared, I changed the acronym to S and E on the end for RISE. We want to rest the spine. We want to be able to take breaks, maybe take a nap, lay down, sit down, stretch, ice the area. You can also heat in certain instances, but we recommend icing. Stretch the area and then exercise. We've got to keep movement in the spine or we're going to lose things over time. And so we've definitely got to encourage that movement. So these are things you can do at home. You can rest, you can ice the area, you can stretch the area, and then exercise with what you know.
Yeah, the joint spaces are all moved from muscles. So every joint that needs to move, a muscle has to move it. If you're having joint dysfunction, you're also going to have muscle dysfunction. Once again, it's like peanut butter and jelly. They go hand in hand. Okay,
Yeah.
so if you want that joint dysfunction to get better, you
Mhm.
need to have muscle cohesiveness to function with that joint so that you're not having continual issues.
Yeah,
All right.
absolutely. The analogy I want to use there is like tires, right? Typically, we have 4 tires on our vehicles, unless you have a motorcycle. But if one of those 4 tires has a big problem, the other 3 have to compensate for it, and we might not drive very smoothly, or we might cause damage on the other 3 tires for the wear and tear change that happens.
Yeah. So, what about some of the movements?
Yes. There's different types of stretching for different regions of the body. I always find Pinterest to be a good resource sometimes for different types of stretching. I just found this wonderful visual of some low back stretches and lower extremity stretches from when you were in gym back in the 60s and 70s.
No. This is like a 1980s PE class movie we had to watch.
Oh, is that what that was? I thought, I just found it in your memories.
Nope.
File.
Not that old. Not that old. But I do remember doing calisthenics in elementary school.
Yes. So basic movement.
We had the Arnold Schwarzenegger, like his health fitness. Something came out, I remember it was like middle school. It was about Arnold Schwarzenegger. It was like his fitness challenge. And I just remember having to do that. Now I look back at it, I'm like, Arnold Schwarzenegger, I don't think he's ever stretched a day in his life.
I don't know who Arnold Schwarzenegger is. Isn't that the governor of California?
It used to be the governor of
I'm
California.
just kidding. But yes, different stretches is always a great option. There's different ways to stretch. One of the recommendations we make here in the office is yoga, to stretch for yoga.
Yep.
There's great breathing techniques associated with yoga. There's great positions and a ton of modifications for the different stretch positions to make sure that, if you have a great instructor, they'll be able to modify things to allow you to get the best result in the most comfortable position as well.
Perfect.
And then also strengthening, we talked about a lot of degenerative change that happens. So one of the things you can do at home or on your own time is Pilates. One of the best recommendations for different type of degenerative change is reformer Pilates. There's a lot of facilities in the area that actually do this. And so reformer Pilates takes gravity and our body weight out of the question. So if it's difficult for you to stand, this is the ideal thing for you to do because you lay on a spring resistance device that actually helps you pull with the strings and springs. And so it's actually a phenomenal tool to help engage a lot of those core muscles that surround the spine and allow us to get those movements we need and strengthen and make the progress we need on our own.
Yeah.
So, yeah.
So if you've stretched and you've done some strengthening exercises, you've given it a little bit of rest, but you still have this pain, it's still there. Oftentimes, patients will either go to urgent care or their primary because they need some additional help. You've done everything that you can at home, and now you're like, I need some help here. So you go to your primary, and typically what we start with is, anti-inflammatories, because there's something inflamed in there, not just the bone from their arthritis, but also the muscles that move that. So those anti-inflammatories are what we typically would start with. However, with radicular symptoms, we see that the Georgia Institute of Health from the University of Sydney noted that non-steroidal anti-inflammatories and a placebo, a sugar pill, had about the same amount of relief for patients. So what it's saying is you can either take a sugar pill or a non-steroidal anti-inflammatory and still get the amount of relief, which is not very much. So that shows that they just don't do very well to help with pain, if a sugar pill can also do about as good as the non-steroidal anti-inflammatories do. But of course, there's other medications that we can go into. With radicular symptoms, we can also take gabapentin or Neurontin. Some patients are very familiar with that. And that just kind of helps calm down the signals from the nerve. So there's still nerve impingement, or, the signal's still there because the nerve is having dysfunction. The thing is that the pain signal going back to the brain is now being turned down, or the volume, which they turn the volume down just a little bit so the patient doesn't feel this much pain symptoms coming through.
Absolutely.
Yeah.
So it does a lot of masking is what it does. It does help. It does make you more comfortable, but it does a lot of masking. So if you're not doing something with it in conjunction with it to correct it, typically we don't get the results that we want.
And to mask it is a good term, but then that can also be good for the patient because they don't feel it, but it's also detrimental because then patients end up doing certain things that they shouldn't. Your body telling you there's pain, it's telling you that you need to do something and not do activities that increase that pain. You want to decrease the pain. But if the pain's there and it continues on, as you went through the gamut of medications, the last resort is they actually go in, a neurosurgeon or orthopedic surgeon can actually put hardware to separate those spaces and then stabilize it, so you're not having that pain of the radicular symptoms from the pressure on the nerve root.
Yep. So they'll go in there and they'll kind of clean out the area, the holes that the nerve comes out of, and then they'll stabilize it so it doesn't continue to degrade over time again. And so they'll typically do hardware to hold it in place so it doesn't move. It's a phenomenal thing for patients that it does, that do require it. And then, for us, what we can do even after that to help prevent further damage above and below where the fusion is we can actually work above where the fusion is, and we can work below where the fusion is, so that we can actually help make progress and prevent those last two joints in that region, or whatever joints are not fused, to keep movement in them and help support them as well.
Definitely. And unfortunately, a lot of times you see with patients that do get fusions, those bones are designed to move. They should be moving, and with all joints, motion is lotion. You need that lubrication to help that joint space be healthy and happy. If you fuse it and you lock it down, in this area that's locked down, that's done. There's nothing you can do about it. But the areas below it and above it still need to move. And unfortunately, you'll see just a progression, and a further progression and further progression, because there is no movement here. So this chain will just come further and further and further and further down if they don't get proper movement in there. Yep. There's a couple other views we have of some of these.
Yep, and this is just one of the previous one was of the neck, and this one's of the low back. You're just seeing it from two views there. Yep. So again, there's the movement above and below those images. And so a lot of what we do is help to either support patients who have already had the surgery or been on the medications, or even if it's your first time experiencing it, we help you here in the office. We can actually help support you through that process to get the pressure off of the nerve root, and also to help relieve a lot of those symptoms and get you comfortable. One of our first goals for just about any patient, if not every patient that walks in the office, is to get you relief. We've got to get you relief because there's a reason you're calling typically. Yeah. And so, one of the ways we do that is with trigger point
injections. Yes. Great option to help relax those muscles. So those muscles have dysfunction because the joint space is not working very well, and you're getting these radicular symptoms. So what happens is your muscles will then contract to try and hold that so that it doesn't move and irritate that joint space more. You actually need that joint space to move. So you got to relax those muscles, and trigger point injections are great to just melt those muscles like butter. We use 3 simple medications in there. 2 of them are just simple numbing medications for comfort, like when you go to the dentist when they numb your gums. The third one is a natural long-term anti-inflammatory made of 13 botanicals. And it's a great option, so much so the Department of Family Medicine from University of Michigan noted that it was the most effective method to treat stressed muscles. So trigger point injections are very good, and a lot of times we will do them in succession. So like once a week or once every couple of days, we'll do one to help relax those muscles that are very, very tense and tight within that area.
Lonnie, can you elaborate a little bit on what a stressed muscle would be?
So a stressed muscle, you will feel those. So if you've ever felt on your back and you just feel like a hard knot, that's a stressed muscle, and it's very tender and it's very painful. Oftentimes patients will go to a masseuse and say, I just feel real tight, or even if you're getting a massage and somebody hits a stressed muscle, it's a muscle that's compressed, and it's more of a spasm. So you will feel that, and it's very painful and it's very weak. It does not hold the way that a relaxed muscle does.
Yeah. Absolutely. Awesome. Thank you for explaining that. And then also what we can do here in the office is rehab, right? We talked about stretching, we talked about exercises, different types of exercises you do at home, but if you need some additional help, we actually can specialize in that and help you with that as well. So different exercises to help different areas of the spine so we can better stabilize and stretch, because if there's 2 things I know we need to do with the area when we have radicular symptoms is we need to increase range of motion, and then we also need to make sure that we strengthen those muscles, because typically it's from some form of compensation and weakness. And so with that,
we don't want it to reoccur.
Yeah, absolutely. We do not want to have it reoccur. So these are some images of the facility we have here in regards to the rehab mats, and then also a wonderful device called a Precor, which really allows us to hone in on a lot of those core muscles that get tight and we need to stretch them out.
Perfect. Some other extras there, but this one is one of my favorite.
Yes, this is everybody. This is everybody's favorite. Our back on track. So we have some phenomenal state-of-the-art decompression chairs here in the office. And we've talked about a lot of different topics here on Medical Monday. This is one of the devices that covers just about all of what needs to happen when we talk about joint health in the spine. So these decompression chairs not only stretch and open up those joint spaces, but they can also turn in the directions to open up. If we don't want to turn in one direction, we can open up the joint space in a different direction. It adds heat, It adds vibration. We are doing the stretching, and it's in a very, very, very comfortable position. So it'll lay back, your knees are slightly bent. I mean, it is a phenomenal piece of equipment in regards to getting the therapeutic benefit we need and getting the function back that we need, and then also making sure that we, get you the relief that we talk about.
So a part of radicular symptoms is that nerve root damage, or the pressure on that nerve root.
Mm-hmm.
Oftentimes it's unilateral, which means it's one-sided. So if it's on the left side, we know that that nerve is being pinched there.
Mm-hmm.
With this specific device, we can rotate the patient so that that left side will open up,
mm-hmm.
so that you'll get relief. A good thing about, she talked about the heat and the massage. That's great because it also works on the soft tissues, the muscles
mm-hmm.
that we talked about that are really tight and spasming in there, trying to hold that joint space and lock it down. So it really helps on all areas for radicular symptoms to get a very, very good result.
Mm-hmm.
But beyond the chairs and the exercise equipment, some specific things that you can do, Dr. Gabby.
Yeah, absolutely. Adjustments, right? If there's anything that we need to do is really get movement in those joint spaces, and a spinal adjustment is one of the most effective ways to do that. So we can hone in on exactly what area of the spine needs to be adjusted, and then actually where does it need to be moved. We have some phenomenal equipment. I can use something as simple as my hands, or we have some advanced equipment to allow us to use a gentler style. Because if there's one thing I've learned in practice is that when you have a patient that's in acute pain, which is very typically sudden pain, they're in a lot of discomfort. You can see that they're having a difficult job walking or sitting or moving. You can't always manually adjust those patients because they're so uncomfortable. They're fighting you, you're fighting them, and it's just not a beautiful cycle. So what's so wonderful about the equipment we can use is it allows to take a lot of that discomfort or that fighting out of the picture, so that it's a more comfortable adjustment, a more comfortable experience, and a very positive response to the treatment in regards to everything. So yeah, that's what we can do.
That's always the name of the game. We want a positive response, no matter what it is. If you can get relief at home, great. If not, you're having problems, we have multiple options to be able to help out. But the bottom line is, so that you know what your options are, what causes radicular symptoms, what your options of treatment are, along with some great tips.
Yeah, absolutely. Great tips. So if you know anybody that has radicular symptoms, please share this video with them. If you yourself have radicular symptoms, come into the office. That's honestly what we specialize in. And so absolutely.
Great. Until next
time.
Monday,
Yep.
we'll bring some more tips for you guys.
Yeah.
Bye.